All right, now move on, and it's time to talk about the role tech can play in minimizing or even eliminating medical errors. The World Health Organization's data says medical mistakes cause 2.6 million deaths every year. A Harvard study has said that 5.2 million medical errors are taking place in India alone each year. According to the British Medical Journal, the healthcare ecosystem in India is understaffed, overburdened and ill-prepared. But technology can go a long way in ameliorating the situation, be it in reducing hospital falls, post-op complications or even hospital infections. How is that possible? Well, to throw light on it, we have with us today Deepak Sharma, co-founder and CEO, Medlearn, which is a health tech startup launched in 2020 to upskill doctors and medical students with the help of AI and VR. Welcome to India Ideas, Deepak. Now, how does Medlearn help in reducing medical errors or mistakes?
Hey, thanks, Gordon. Thanks for having me. So if you look at what you just pointed out in different studies, now the different kind of errors, whether it's outrightly misidentification of a patient, mismanagement of medication, right? Similar sounding medication, surgical site infections, falls, infections, sores. In the end, there's always a human factor, right? And all studies show that the errors, if you look at that, they're about maybe 65% of them can be traced back to 3 or 4 causes. They are typically lack of knowledge on the part of the healthcare worker, having the knowledge but not being able to apply it as a skill in a real situation, and cultural and communication things. Now, all of these are trainable things. Now, one thing that Medlearn's tackling is bringing really technologically effective tools to really enable the human factor in care in the last mile, to be able to really give them the right knowledge at the right time and to be able to give them the right data to manage all these situations and avoid medical errors and prevent all those losses that you talked about.
Okay. Now, you say you use AI and VR to upskill doctors and medical students, but overall, what kind of tech tools are being used or can be used to reduce or eliminate medical errors? From the cases that I came across during my research, it could be as simple as a quality and safety dashboard or something really cutting edge as well.
Right. So, part of that is AR or VR, but as you pointed out, starting from quality dashboards to the AI algorithm, everything feeds on data, right? So the data could be coming from diagnostic tools, the data could be coming from actual patient records, data could be coming from genomics, labs, the data could be coming from research. And all of the, and now, if you see the policy, you might want to talk about the data from even wearable devices like your watch can be used to really improve diagnostics, improve care, improve the administration of care, and throughout post-discharge as well, keep monitoring that. All of that can be used to minimize and reduce the human error where it can be reduced and enable the last mile where the actual human responsible for delivering care has the right knowledge and tools at their fingertips. One study shows that about 80 years back, medical knowledge used to take about 60 years to double. These days, medical knowledge doubles every 73 days. So, given that all that people are dealing with already in hospitals in emergency crisis, there's new research coming on, not being able to provide them the new tools, new knowledge, the new insights when they need it at the point of care is something that feels almost negligent. So that's another thing tech can tackle by really making the right knowledge and decision support tool available to the doctors, nurses, and every care provider at the last mile at the point of care.
Yes. Now, the perception is that such tech tools are expensive and difficult to adapt to for doctors and nurses who are already overburdened with work. Is that misplaced, or if it is an issue, what is being done by health tech startups such as yours to dispel such impressions?
Okay, so if you remember the mobile technology, we took a leapfrog over the rest of the world, right? We were late in starting, but we got GSM. The costs are much lower. Data is really one of the cheapest places in India, even compared to large developed nations. Now, I think a similar revolution can take place, is ready to take place, and we're enabling it in India. We can really leapfrog all the high-cost innovations, etc., by coming in second. It is the second mover advantage. Now, in fact, Medlearn's trying to bring that mission to India to bring really world-class tools and technologies at very affordable prices, right? So, when we look at the kind of tools, it's literally less than the cost of a cup of coffee per employee per day, right? And really, if you look at the flip side of it, the hidden costs of medical errors, whether it's negligence claims, loss of lives, loss of livelihoods, just brand reputation being lost, a lot of that is humongous. It's 100x kind of what you might want to pay for the right tools. So people often ignore short-sighted the hidden costs, which comes of not doing the right things.
Okay. Right. Now, the future of healthcare is digital. The government itself, its initiatives like the National Health Mission are a clear indication of that. Now, what more can be done to ensure that India uses its health tech capabilities to the maximum extent to not only serve its own healthcare needs, but even the rest of the world, not just, in eliminating medical errors, although that is a huge part of it as well?
Right. So, as we were talking about a bit earlier, the ability for India's, manpower to provide that impetus, provided we give them the right sort of tools and technologies, and look at the skilling part of it, in a very tech-savvy way. We have had some foresight. If you see the policies, the National Digital Health Mission, which is again digitizing all healthcare providers, all healthcare, institutions, patient data with privacy. A lot of that is very solid foundations to gather up all the data which will in the future feed algorithms. But the short term, I think there are other more interesting legislations which have talked about really professionalizing all the new and emerging streams of healthcare careers, from mental health to everything. There's been a bill on allied health professionals. There's been a revamp of the medical council norms. There's a similar thing on the works on the nursing side, which has been stuck for a couple of years now. What we really need is the right regulation and the right legislation where it affects the safety and the quality of delivery. But what we might be heading towards is a simplification of the laws, keeping the care. Do we need all the states to have medical councils, nursing councils regulating it differently? Health can remain a state issue, but do we really need to have licensing and regulation of education and health and services in like 30 different places? Now, those are the questions we need to answer, really simplify it, because if you can take in and send talent to the rest of the world, the English-speaking world particularly, nurses are shortage, why should there be barriers within states? Why should there be different regulations, different standards, different licensing norms in different states in India? I think there's time to simplify. A lot's been done already with the new policies. There's a few more red tape to cut. I hope the government is looking at it.
Okay. And I believe that the kind of programs that you have that focuses a lot on soft skills as well among medical professionals, not just doctors, but others as well. And also, the other aspects of, say, even administering or running a hospital. How important is that to ensure that things remain error-free?
Yeah, so if we were looking at it, the NAB Edge, which has a very systematic way of giving quality accreditation. If you look at a typical quality audit, it looks at training aspects. It's always literally 85, 86 different kind of training aspects. So healthcare is a very unique thing. So to be able to skill people from managing the basics of, patient care to actually running and administering a hospital, looking after the equipment, making sure training is refreshed, preventing decay of knowledge. I was talking about this, you forget things fast. And if training is imparted in 3 months later, you don't get a chance to work on a case like that. You're not going to remember it when you need it. So some of those tools are really very effective, whether it's soft skills, management skills, refreshing your patient's skills. So all of that entire stack of training becomes absolutely essential if you really want to run a hospital well.
All right. Well, let's hope that this really gets the kind of attention that it should be getting as far as eliminating medical errors is concerned. The entire ecosystem needs to adapt it as much as possible, and let's hope that you keep getting more business that way, so that all the patients everywhere can benefit. Thanks a lot for joining us for the moment, Deepak.
Thanks, Gautam. Thanks for having me.